Well, let's talk more about those developments in the search for a possible COVID-19 vaccine. The Health Secretary, Matt Hancock, has said the NHS will mount a colossal effort to ensure people receive the new Pfizer vaccine once the government is confident it is clinically safe. Let's talk to Dr. Duncan Robertson, Policy and Strategy Analytics academic at Loughborough University. Thank you. Basically, your area of expertise then that's particularly pertinent right now is about the vaccine distribution and how it might all work. So tell us what hurdles remain now to effective distribution of this vaccine, assuming it gets all the go-aheads through the remaining testing processes.
Well, I think that's quite a big caveat in terms of making sure that we know exactly who this vaccine is beneficial to. So at the moment, we know there's a trial. We've got preliminary evidence from that trial, but we don't really know whether it'll be effective for elderly people. And of course, elderly people are the ones that are most vulnerable to the disease, and they're the ones that are potentially, going to be most benefited by this vaccine. But as you say, the logistics of actually getting the vaccine to people, it's a huge task. And of course, we concentrate on the UK, but it's a global task. And of course, these vaccine manufacturers are not just providing us with vaccine, but providing the whole world. But I think it was good that the Secretary of State talked about GPs actually distributing the vaccine, because of course we all want to be vaccinated, and I think getting compliance will help if your GP is vaccinating you. But it's a tricky logistical operation, particularly if some of these vaccines have to be chilled, and not just chilled, but minus 80 degrees. And that's not something that's of regular use in GP surgery, so that we may have to find groups of GPs getting together with logistics in the background. Perhaps Matt Hancock talked about the armed forces, and of course they do logistics very well.
I just want to go back to what you said about it not being clear whether the vaccine would be beneficial to the elderly. Is that because it wouldn't have been tested on the elderly? And why would a vaccine have a different impact on different age groups anyway?
Well, I think the point is we don't know. We've got a press release from the vaccine company Pfizer, but we haven't got the full results. And that's what all the scientists are waiting for. They're waiting to see who's been vaccinated and whether there's any differential benefit or disbenefit for different groups. So I think this is, when we're talking about do we actually get the vaccine, the JCVI, the Joint Committee for Vaccines and Immunisations, has a preliminary list of priorities. And it's quite important that it's not set in stone yet, because we don't really know whether these vaccines are effective across the adult age groups. So that's why provisionally we're talking about the people who are most likely to die, really, and they're the elderly people, but particularly people in care homes. And we saw, certainly in wave one, care homes were particularly badly affected. So that's why they're the top priority: care home residents and care home workers, and then NHS workers. And then we go down the age groups. And we also have high-risk individuals somewhere between sort of very elderly people and sort of 50-year-olds, so that they're prioritize more than other people. But what we're doing and what the JCVI is doing, they've set out their objectives very clearly. What they're trying to do is to minimize mortality, minimize deaths, but also to protect the NHS, and not just protect the NHS, protect the social care system, which was particularly badly hit in the first round.
How hard is it actually to test a vaccine when people are socially distancing? I mean, there was a lot of talk for a while about the COVID cases having reduced dramatically, and perhaps that would impinge on the ability of the development process to actually have an efficient testing program. But even once the cases have been rising, people are staying away, obviously, when, sort of isolating when they've got it, and socially distancing otherwise anyway.
Well, I don't know about the specifics of the Pfizer trial, but certainly what some vaccine manufacturers have been doing is to actually look for places where there is a relatively high incidence. So, for example, the US, South Africa, for example, they may have tested there because they have high incidence. And of course, you don't want people to catch the virus, but of course, it's good data if some people do. And I think that's where some of these trials have been. It's a global effort, and it's not just confined to the UK. So UK people aren't in any way different to anybody else. we all catch the virus. And so the data comes from a really global effort around the world.
Would every demographic be vaccinated ideally? Would children be vaccinated? Because we do know that the virus has a different impact on younger versus older.
Well, what the JCVI have said is that they've concentrated on adults. So if you look at the prioritisation they have, it talks about adults in social care. So I think we have to find out whether it has been tested, whether the vaccine, we do have data for children, but I think certainly at the moment, we're looking at the adult population being vaccinated, and further trials may have to take place to look at other sectors.
And what are your thoughts on when society may return to normal?
Well, I think we just don't know. I think we're all fairly optimistic. We're looking to 2021, I think, probably around the summer. But, you know, what is normal? And I think one thing that can help is to realise that actually this vaccine isn't a magic solution for the short term. We still have very high prevalence of the vaccine across the UK, and we need to make sure we get that down, because that's going to save lives in the short and medium term, and the long-term solution is vaccines. And we need to get test, trace and isolate working, and then we can get back to our normal lives.
Dr. Duncan Robertson, thank you very much. Now let's catch up with the sport. Holly has the details at the BBC.